So one of the procedures that really makes a huge difference is something called a neck lift or neck lifting procedures. These also many times also involve a procedure that will contour the jawline at the same time. What we'll start to notice is some laxity right where the neck angle is, and sometimes we'll have a couple of little areas of droopiness there, and that starts early and then can sometimes get a little more obvious as time goes on. That involves not only droopy skin or laxity of the skin, but there's also some fat under there in everybody. And there's also muscle that's there as well, and that muscle sometimes can get lax and can also drag the skin down a bit as well. So we work on all three of those areas in trying to make sure we give a good contour, particularly not only to the jawline, but that neck angle that everybody wants to see. When we perform these procedures, we do our best to make sure that we are tedious with our incision line closures so that they become absolutely minimally noticeable, well camouflaged, and so that nobody notices, and our goal is even somebody sitting next to you couldn't tell.
Several years ago he did a neck lift on me and it held up very well, but then as we age and gravity wins out again, I wanted to have it redone, and so he did that, and he did it under local, which I was a little apprehensive about, but it went just fine. I slept through the majority of the case, and I'd wake up, we'd talk, and I'd go back to sleep a little bit. And so finished up, I would highly recommend doing that. It saves you an anesthesia fee. And but it went very well. And I'm 3 weeks out, back to work. The bruising, once it settles down, it sort of settles down around the bottom of your neck. So if you have it done in the winter, you can get away with a turtleneck or a scarf or what have you, and it's really, there wasn't that much bruising. Good bit of swelling, but that goes down. You keep your ice on it, it goes down, and it just heals up really, really easily. And so this is 3 weeks out, and as you can see, my neck looks nice, my incisions look good. So he just did a fabulous job, and everybody, I have no qualms about it. So as I said, I've known Dr. Abramson for over 20 years, and he's always just been very attentive to my needs, and here lately he will start suggesting things that I do, which I really like, because sometimes you don't think of these things. And so we're going to start playing around with his laser a little bit, but I'm just thrilled with my outcome. It looks great, it makes me feel better, because most women don't realize that while they focus on their face, the general public tends to look at you as a whole, and they notice your neck as much as your face. And especially if you wear your hair up, and I can wear my hair up and it's still going to look nice. And I am single, so it's very important to me that I be able to go out and hunt with the other women. So, but yeah, I would highly recommend him, and he can tell a few lame jokes in amongst being clinical, but he's a great guy, and I certainly would not have gone under the knife with anybody other than him, because he is so particular about what he does. And I'll make a suggestion and he'll say, "No, Norma, you be the patient and we'll be fine." And we're fine. So I'm very happy, and I just recommend him wholeheartedly.